Welcome to So Tell Me, the podcast where I talk with fascinating professionals about the work that they do. I am Dr. Melissa Deuter, and today I'll be talking with Dr. Chris Ticknor about his work in forensic psychiatry. This podcast is sponsored by Sigma Mental Health Urgent Care, located in San Antonio and Austin, Texas. Okay, so Chris Ticknor, I'm going to start with how I know you, and then I'm going to ask you about your work and what you're doing now and how you got to here over the course of time. So,
Thank you. I'm looking forward to it. Thank you, Melissa.
okay, we first met when you were giving the private practice lecture to the psychiatry residents when I was a third-year resident. And so
Yes.
that was my first introduction. And then in my fourth year of residency, I had been chief resident and had been working with the faculty at the medical school and realized that what I thought I wanted to do, which was be on the faculty at the medical school, was not what I wanted to do because people seemed really unhappy. And I recalled you and John Tierney had given that lecture on private practice, and honestly, y'all were some of the happiest looking professionals that I had seen. So I called you
Well,
up
thank you.
and I said, "Do you have space in your office?" And you said, "Actually, I don't." That was our first conversation. You said, "I don't have space in my office." And then you called me a few weeks later and said, "Actually, the timing was perfect. Somebody's going to move out. We do have space." But
Mhm.
even when I called you, you said, "I'm happy to mentor you. I will help you in any way I can and kind of help you go into private practice if that's what you want to do." And it was very generous. And so like that's where we started. Um, and then we officed together for 14 years, I think, something
Yes.
like that. And then I moved out of the private practice office to come do what I do now with Sigma. So that's how I know you. And so, I mean, as an office mate, you're in the office down the hall. I would pop in and talk to you. I might talk to you about a case. You'd refer me a family member of one of your patients. Um, but we never sat down and talked about the forensic work that you do directly. And so that's what I want
Yes.
to talk about. I want you to tell me how you ended up doing what you do.
Well, thank you. And I will go back in time a little bit and begin with how I actually found my way into psychiatry. My undergraduate degree from SMU is in biomedical engineering.
Okay.
And at the time that I was an engineer, most of what we were doing was electrical engineering. My plan was to go to Southwestern Medical School as a graduate student and create artificial hearts, artificial limbs, program machines for detecting human illness and such. I actually did go to Southwestern for a year as a graduate student and worked with a brilliant neurology physiology researcher in how to determine what causes fever in humans, and published about half a dozen articles on the, if you will, the genesis of what causes fever and how to control it so that people don't die from hyperthermia, particularly in children with severe infections. While an engineering graduate student, I realized I was working with capacitors and resistors and circuit chips, and I really missed the human element, the human contact. So I did a 90-degree change and went to medical school. And as a medical student, I assumed I would go into cardiology or ophthalmology so I could work with instruments, so I could do engineering in medicine. My third year clerkship in psychiatry, I fell in love with the last, what I call the final frontier of medicine, understanding the human brain. And that was 1983, and I haven't looked back. I have had a 40-year career in psychiatry that has been a true blessing in my life. And I would say that with few exceptions, every week, every month has brought me great sense of fulfillment and of being able to make a difference, hopefully, in people's lives. How I
Okay.
got into
Question.
forensic psychiatry?
I
Go
want to
ahead.
stop and ask a question about, so you in biomedical engineering, why was that what you were interested in? Is there somebody in your family who does that? Had you had some exposure?
I was your proverbial high school science geek. I loved physics. I loved chemistry. When I got to SMU, by the way, I went to SMU on a full scholarship called the Eugene McDermott Scholarship. It was an engineering scholarship. Eugene McDermott was one of the three founders of Texas Instruments, the entire company. And while I was at SMU, TI actually introduced the first handheld calculator, if you can believe that could actually do things like trigonometry and calculus. So I carried around the proverbial slide rule in a plastic holster attached to my belt. And I loved it, but I also looked around the room when I was in engineering, and if there were 25, 30 students in a class, I would go, how many of these people do I really want to be my best friends?
Uh-huh.
And so I loved engineering, but I didn't feel quite at home with the limitations of the introverts and the social network. In psychiatry, I found, if I may, the beauty of people who are free thinking, can think outside the box, are very socially adept, and in fact, focus their entire career on understanding the dynamics of communication.
So when you rotated in psychiatry and fell in love with psychiatry, what was the setting that you rotated in as a medical student?
I was on, in those days, was the 7th floor at University Hospital. I
I
had
rotated there.
three great, yes, back in the day, right? I had three great mentors who I tremendously admired and respected. And so my first real exposure to psychiatry in a clinical setting was the most severely psychiatrically ill, the schizophrenics, the bipolar patient who was manic or suicidally depressed, people who were withdrawing from substance use disorders. And I found it fascinating because every patient was different. I contrasted that with my rotations in internal medicine, pulmonology, even pediatrics to an extent, where, of course, every patient is different. But if I may use cardiology as a parallel example, once you've treated your 20th patient with an inferior MI, they're all the same.
Yeah.
You order the exact same lab tests. You order the exact same studies. You look at the exact same EKG patterns. And I realized that if I was going to do that for the next 20 or 30 or 40 years, I thought that there would be a fair degree of monotony in that.
Yeah, so
What I
you're
was really appreciating,
at that point, you're just delivering the same service and there's not a lot of creativity or problem solving for each case that's unique.
exactly. In fact, some of the senior residents I work with on internal medicine, general surgery, OB-GYN, they actually had pre-printed stamped admission orders because they were all the same. Although there's some similarity in that we do certain things when anybody's admitted to a psychiatric unit, a psychiatric hospital, the set of symptoms and trying to sift through what is happening with that person's emotional and mental cognitive functioning, every patient is, in my experience, rather dramatically different.
Yeah, yeah, I agree with that. And then, okay, so I interrupted you, but you were going to say then how you got from there to forensics.
Yes. So I had been in practice maybe 10 years, and I took care of a young woman who had been seriously injured in a motor vehicle crash. She had been a backseat passenger. There was a head-on collision. She was paralyzed from about the thoracic 12 level down and would be in a wheelchair the rest of her life. Her rehabilitation doctor at Santa Rosa Northwest asked me to come treat her because she was spiraling down into a severe depression.
And were
And
you
I
in
would
private
do
practice at that point? Is that what you were doing or?
absolutely. In fact, when I finished my residency, I stayed on the faculty for a few years and ran the emergency room for the Department of Psychiatry. After doing that, I transitioned into private practice 10 years later, while I was in private practice, I happened to get this one referral.
I see. Okay.
So after treating her for about 6 months or a year, I knew that there had been a severe motor vehicle collision, and I was contacted with her permission by her attorney and asked if I would testify in her liability trial in a small town north of Houston called Huntsville, Texas. And it was the very first time I'd ever considered that a psychiatrist might be involved in a court trial.
Yeah.
And the basis of the trial was she had been injured. The fault had been the driver who collided with the vehicle in which she was riding head on, had crossed the center median and come across, and the insurance companies were arguing with each other about whether or not to pay her medical bills.
Ooh.
So my role was very small to try to educate the jury that as a result of this tragic accident, she had become severely depressed. I will throw out also, prior to the accident, she had been an all-star soccer player and a ballerina.
Wow, that's awful. What an awful situation.
If I may, I'll just mention one thing about the trial. Her attorney was a tall, 6'3" Texan wearing a cowboy hat and boots in Huntsville, Texas. The opponent on the other side, the opposing company, was the Hartford Insurance that, for reasons I still don't understand, refused to pay the maximum they could for her medical care, which was $250,000. And I won't go into the details for brevity, but rather than write a check for $250,000, they went to trial trying to get a verdict where they had to pay nothing. Well, the attorneys they sent down from Hartford, Connecticut, were wearing Brooks Brothers double-vested suits, wingtips, and tortoise shell glasses, which, by the way, I own a pair. I have nothing against tortoiseshell glasses. And in fact, I'm not originally from Texas. I'm from the Northeast myself. However, the jury awarded her $3.2 million rather than Hartford write a check for $250,000.
So they made
So
it.
I tell you that exactly. You know, you talk about a bunch of foolish decisions on the part of an insurance company. I will say this simply. After that trial, I get a phone call from the attorney for my patient who says, Dr. Ticknor, would you like to review a new case for me as a forensic expert, a testifying psychiatry expert? And I said, well, I've never been asked to do that before, because remember, when you're testifying on behalf of your patient, you're a fact witness. Being a forensic expert where you are not treating a patient is a testifying retained expert. And I asked him, why did you call me? He said, the jury found you believable and credible. And that started my forensic career.
Interesting. And so you mentored me a bit, sent me some cases. I did some forensic work. I'm not bad at it. I'm probably pretty good at it, but I don't like to interrupt clinic. And so I want to know how you balanced providing clinical care with this practice where you're called out of the office. I always felt that it was a disservice to my existing patients to interrupt care in the way that you have to do to move things around, because you'll be scheduled to testify on Tuesday and suddenly they don't need you on Tuesday, they need you on Wednesday. So you've got to move all your patients who are scheduled on Wednesday, and I just hate that. And so that of all things is the reason I don't want to do it. I like being on the stand. I like doing the case reviews. I've done some forensic training. There are many parts of it that are good, but it just is too disruptive, I think. What do you think about that?
I completely agree. And early on in my career, it was a juggling act. But I found an interesting, or I'll share with you, an interesting observation. From your perspective and from my perspective, it's annoying, inconvenient, cumbersome to have to switch your schedule around. I trained my secretary, as my volume of forensic work increased, to say to patients, we are so sorry that we need to move your appointment from Tuesday to Thursday. Dr. Ticknor has been asked to testify as an expert in a trial, and the judge requires that he come on that day. And you know something? It enhanced my practice. My patients were fascinated by it. I think it increased their respect for my work. And oftentimes it was an icebreaker for patients who may not have been particularly interested both in therapy and appointments. Suddenly they were coming in going, "Tell me about your forensic work, doctor." Of course, I'd keep it very brief so that we could get back to them. But after doing that for 5 or 10 years, Melissa, I decided I don't want to have that juggling, balancing act going on all the time. So I reduced my practice to 3 days a week,
Right.
Monday, Tuesday, and Wednesday. And I let every attorney that retained me or contacted me know Thursdays and Fridays are really the only days that I do forensics. If you can work with that, then I can accept your new case. And the vast majority of attorneys respected that boundary. However, there are definitely exceptions depending on the court. Another possibility, and I did this occasionally, would be if a patient complained, if a patient was inconvenienced by me switching their appointment because of my forensic schedule, I always offered them a 10 or 20% professional discount. In other words, if you're going to accommodate my schedule, I am so appreciative of that. I'm going to offer you a 10% or 20% discount on my charge, my fee for your care, because I recognize you are accommodating a schedule that neither one of us can have absolute control over. And, you know, I think 95% of the time patients were very appreciative of that, and it did not become an issue in their therapies.
So let me ask you something else. In the forensic work, have you felt like you make a difference? And how so?
Yes, yes. I think forensic experts in any specialty, not just medicine, and certainly not just in psychiatry, but we make a difference in clarifying issues, defining what is going on from a medical psychiatric perspective, and it allows attorneys from both sides and often plaintiffs and defendants to settle cases successfully. And, you know, it depends, of course, on the attorneys involved, and sometimes even the carriers, which we are defining as the insurance companies. But if somebody, I'll give you a good example. I reviewed a case years ago of a gentleman who was riding a motorcycle and he got run over by a large 18-wheeler truck, and he had a significant traumatic brain injury. And the attorney who had retained me, I had worked with before, and I think his hope, his intention was by retaining me as an expert, that I would try to minimize the impact of his traumatic brain injury. I did not. I said, this man will continue to have constant communication difficulties. This was, by the way, 2 or 3 years after the incident, so that there was no expected additional improvement in his neurocognition. However, what I said to the attorney was, what you see is what you get. I did something called an IME, an independent medical examination of the plaintiff, and determined that he had areas of deficiencies in a number of areas that would no longer improve, and he would need care in these particular areas indefinitely. The attorney was not happy with or let me rephrase that, he was disappointed with my opinions, but they were what they were. And because we had worked before, we had a foundation of respect where he went back to the insurance company. He said, Dr. Ticknor says these are areas that are not going to improve, and I think we have to accept that Dr. Ticknor's right.
Yeah.
It helped to resolve the case without having to go through a lengthy trial process. And when an insurance company becomes more pliable, when they become a little more flexible in settling a case, you know, based on the actual damages, I think both sides come together in a healthier way. And I believe it benefits the plaintiff. It identifies the person who's actually been injured.
So, so on that, I mean, you come in, you're an expert, you're supposed to apply your expertise, right? It's just like if you came in and you were a ballistics expert, you say, this is the path of the bullet or whatever. You come in as a psychiatrist expert, these are the findings, have you ever had an attorney really angry with you because they didn't like what you had to say after they hired you? Because you can't tell them what you're going to say about a case before you get into it.
Um, I don't think I've had attorneys angry, but I certainly have had them disappointed. I will tell you another anecdote if we have time.
Sure.
Tom Coughlin is a San Antonio attorney who I'd worked with before, and he called me about a case involving a psychiatrist. It was a medical malpractice case that we call med-mal, and it was involving a psychiatrist who prescribed lithium for a patient. The psychiatrist did not require, did not request, or educate the patient that she needed a lithium level within 5 to 7 days. The psychiatrist also did not take an adequate medical history and was not aware that the patient was taking a thiazide class diuretic for high blood pressure. So the patient comes with her sister, gets an evaluation, is diagnosed with bipolar, is sent home with a prescription for lithium, which the patient took as directed. 10 days later, the patient lapsed into a coma very suddenly. The sister takes her to the emergency room. She's admitted to the intensive care unit. She dies of lithium toxicity. She basically develops severe brain inflammation. Her kidney shut down. She dies.
That's awful.
Tom asked me to review the awful outcome. And I was working for Tom, who was an insurance defense attorney. He retained me to review the records. I reviewed the records. I called him back and I said, Tom, I probably have bad news for you. I believe that the psychiatrist fell below the standard of care. She failed to request a lithium level. She was unaware that the patient was on a thiazide diuretic. When she did her evaluation, she gathered an inadequate history. And I really can't defend that her practice pattern met what we call the standard of care, that it was proper and that it was medically what any doctor, the average prudent doctor, would do. And Tom goes, gosh darn, Chris, I'm cleaning up my language a bit. He said, I was afraid that was going to be your opinion. And I said, well, sorry to be the bearer of bad news. And he said, damn it, I guess I'll just have to go hire some whore from California to give me the opinion I want.
Well, see, that's part of the thing about forensic work is that if you do it ethically, you're not just going to sell your opinion, right? But then they might find somebody else who will.
Yes, about a quarter of the cases that I review, I do an initial review, which most attorneys request. Then you call them with your preliminary opinions so that they can determine if they want to move forward with you as their expert. Yeah. And about a quarter of the time, the attorneys say, oh, well, that's not exactly what we were hoping for or expecting. So please send us your final invoice. And then they move on to find somebody, if I may, who probably has a lesser reputation that will give them the opinion that they want.
Mm-hmm. Yeah, and that's part of it too. I think I'm personally offended. My sense of ethics and integrity is offended if I sense that they want a particular opinion out of me. You're just better suited for this work, Chris.
Well, I hear what you're saying. I'm not sure that that's the foundation for being better suited, but I will say this, you know, when you develop a reputation in your specialty, and in this case, we're talking about forensic psychiatry, when you develop a reputation as being ethical and pretty unbendable about your opinions, you actually get more referrals because people want to work with you. The best attorneys that I work with, when they receive an unfavorable conclusion from my review of records, they appreciate it. They continue to work with me because they take that information back to the insurance company. Or I do work for plaintiff's attorneys. Plaintiff's attorneys will take that information and go back to their client, and it will definitely speed up a resolution because both sides eventually learn this is the way it is. And it's pretty rare nowadays, after having done this for 25 years, it's pretty rare these days where people doubt my integrity.
Yeah.
And that's true on both sides of the aisle. 20%, 25% of the work I do is for personal injury attorneys. I'm selective about the cases I accept from both sides.
Mm-hmm. So I'm going to change the subject and ask you another question. What was your first job?
I was a warehouse stalker at an Army and Air Force base warehouse in Wichita Falls, Texas. Now, that's my first, if you will, hourly salary job. I know I sound like I'm probably Methuselah here when I say this. My first real job was throwing newspapers when I was about 12 years old in Worcester, Massachusetts, just outside of Boston. When if it was 20 degrees below zero, I never missed a paper route.
And you were on your bike?
I had bike with, the saddles on the side, the chrome steel saddles where you just bundled up, you had gloves on, you were pedaling, you would pull out a newspaper, throw it to this driveway, the next one, back before the internet, of course, when at least in most communities, and certainly in Boston and Worcester, there was a morning edition and there was an evening edition. So I would do it before I went to school in the morning, and I would do it usually around 5 p.m. And in those days, it was certainly 7 days a week, but you only got a morning edition on Saturdays and Sundays.
And what did your parents do for work? What were their careers?
Thank you. My father was the first of his generation ever to go to college. He went to the University of Northern Colorado and was a mathematician. When he graduated in 1952, it was the peak of the Korean War, the Korean conflict, and he planned to enroll in the Air Force, enlist in the Air Force for 4 years. It became a 20-year career. So my father was a career Air Force officer for 20 years. When he retired at 20 years, he was 42 years old. He
Wow.
then engaged in a second 20-year career as an educational diagnostic psychologist. He tested little children in and around the San Antonio area for learning disabilities, behavioral disorders, what we used to call MR, but now call intellectually developmentally delayed, to help place these children into special programs to assist with their learning. He retired when he was about 66 and lived another 25 years.
I had
My
no idea
mother,
your father was doing anything related to mental health. I knew he was in the Army, or in the Air Force. But this is, I mean,
yes,
this is part of why this is so fascinating, is that I've known you for 20 years and I don't know these things about you.
I will tell you that if I were to be honest about my very first exposure to mental health, particularly psychiatry and psychology, when my father did his training in order to become an educational psychologist, he was a graduate student at Trinity University in San Antonio, and he would come home learning the Halstead-Rice-Ritan neurocognitive assessment, the Beck Depression Inventory, back in those days, the MMPI, the Minnesota Multiphasic Personality Inventory, and he would practice on me, my brother, and my sister. So I remember sitting at the dining room table with lots of papers and pencils and circling in the true false on the MMPI when I was about 16 years old.
Oh, how
Uh,
fun.
yeah, how funny is that? I took my first MMPI when I was 16. And my mother put my father through college. My father was both as a senior in high school and in college, he was the starting quarterback for football teams. And when they finished college, my mother was a stay-at-home mom until my younger brother and I were about halfway through high school. And then she became a buyer of ladies' dresses for Sears in Central Park Mall in San Antonio.
Wow. Wow. See, again, things I have no knowledge of this part of your life. I've only known you to be, uh, doctor, mentor, expert, Professor Ticknor. I've never, knew you before you were that. So
We all have a fascinating history, I believe.
yeah, no, that's right. That's part of what's so interesting about psychiatry, right? Is that even if
Agreed.
you have two people who have a similar diagnosis, their whole life story, which is connected to their mental health, is just, it's unique. So, okay.
Let me go back to something, and thank you for mentioning that. Another thing that I love about psychiatry is when I was a medical student, I'll give you an example. I remember starting my obstetrics rotation, which was essentially 7 weeks during my third year clerkship. I remember showing up for a clinic at the Robert B. Greene Hospital on a weekday afternoon at 1 o'clock and being told you have 25 patients to see before you can go home. And realizing at 1 o'clock to 5 o'clock in 4 hours, I need to see 6 patients an hour as a medical student, or I'm going to be here till midnight. And of course, there was a certain expectation that the clinic, particularly the support staff, the nurses, the social workers, laboratory techs, and so on, they really did want to be out of the building by 5 o'clock or 5:30. Psychiatry, on the other hand, I showed up for a psychiatry clinic at the Robert B. Greene. They said, these are your 4 patients for the afternoon. So the ability to spend time with people and get that fascinating family history was something I found very attractive about psychiatry. You typically don't have to see a patient every 8 to 12 minutes. Even if you have a very busy clinic, every patient gets 15 to 30 minutes or more. Every new patient in my practice, for the time that I have always practiced, every new patient gets 1 hour.
Yeah.
In any other clinic, that would be an extraordinary amount of time to spend with a patient.
Yeah. Yeah, I agree with that. I think that's, I mean, that's part of the reason I ended up in private practice is that, there are places in psychiatry where you're in clinic just for a few minutes with each patient. And I just I don't think I can even take the temperature of how a follow-up patient is doing if there are any issues. I just need to hear their story. That's how I understand, and so I need to look and listen about what's been going on and how they've been feeling and thinking. Just what I need to do.
What I love about treating mental health patients.
Yeah. Yeah. Well, so let me ask you, do you think, is there, particularly forensics, I think that there is this kind of negative perception among some people about it, that it's highly paid, that it's, I don't know, that it's, that you're selling your opinion, which we said someone might do, but you don't do. Does anybody approach you in that way? Like the work that you're doing here in forensics is something negative?
In a word, no. Although I certainly think that the perception is more a public perception. Imagine that you are one of 12 people on a jury. The average juror in San Antonio, Bexar County, has a high school education or less, and many of them are the foundation of society, earning $20, $25, $35 an hour. Let's assume that you're in a position as a mid-level manager and you're making $100 an hour. That's a very high-paying job. And then all forensic experts, be it in orthopedics, neurology, gynecology, psychiatry, we earn a lot of money per hour. The going rate in Texas for a psychiatry expert is about $500 to $600 an hour. Dr. David Kessler, who's a former director of the Food and Drug Administration. I was in a case where I was working as a defense expert on behalf of a pharmaceutical company. Dr. Kessler was the expert for the plaintiff in a case of a woman who gave birth to a child with a birth defect while taking Depakote, a medication for bipolar disorder, during her first trimester of pregnancy. My charge then was $500 an hour. Dr. Kessler's was $1,000 an hour. Now, go back to that juror who is earning $20, $50, $100 an hour, and they see an expert sitting on the witness stand giving testimony for $1,000 an hour. I think that's where that negative perception probably originates. By the way, most attorneys in Texas right now who are not insurance-based attorneys are charging $800 to $1,000 an hour. There are attorneys on the East Coast and the West Coast, and it's not uncommon. We're now charging $2,000 an hour for their services.
Right.
I have no comment about that other than that that's what the marketplace will bear.
Yeah. And I think, people look at those pay rates as part of their assessment of the credibility sometimes of an expert witness, and those numbers look very high. And of course, yeah. I remember one time, a long time ago too, and I don't remember exactly what happened, but there was some local news that had a little gotcha thing with you on the news about being a highly paid expert. And they did had a little blurb with you on the news where they at some kind of gotcha journalism moment there about what you were getting paid for forensic work.
I don't remember who said it. It may have been Mark Twain, but all publicity is good publicity. And I don't recall the case, although I have been quoted in the San Antonio Express News 3 or 4 times over the course of the years. It brings me back to something that I think is a parallel observation about being a forensic expert in any field. There are very few people who do this work, and that's why over time across the nation and internationally, the reimbursement for forensic experts has risen. Years ago, when I was the president of our local San Antonio Psychiatric Society, we had 271 psychiatrists on our mailing list for our metropolitan area. If we just say that using that figure, about 270 psychiatrists, how many psychiatrists, Melissa, would you guess in San Antonio right now actually do forensic work?
Oh, I can tell you it's not very, 3 or 4 maybe. And I know because
4.
people call my office wanting forensic work and they want referrals, and I don't have very many names to give them. There are not very many people.
So my question rhetorically, and I do have my answer, I'm not sure there is one answer, but why is it there are only 4 out of 270 psychiatrists in the greater San Antonio area who will even consider reviewing a forensic case?
Well, so I don't know if I know the answer, but I would say my own answer in not doing it is a focus on clinical care. Now, that may not be the case for everybody. Some people may lack experience. They may not feel confident. I know how to do the work, but I'd prefer not to interrupt my clinical work back. I don't know if that's the same for other people. I suspect they don't know how to do it and they've never done it.
I believe there are many different reasons. I believe the first and foremost reason that more medical doctors don't do forensic work can be summarized in one word: fear.
Mhm.
For all of our years of medical school and residency and all of our clinical experience, we are advocates for our patients. We accept them as they are. We don't, even though we may have some skepticism of some of their reports, and we understand that our own experiences are influenced by our developmental years and our family of origin issues and so on. But our job is to take what happens, what exists with the person that walks through our door, and to begin with that as our starting point and to move forward to help that person with their mental health issues. Forensic work is adversarial. There is no advocacy. In fact, advocacy would contaminate your ethical objectivity.
Right.
They're 2 different worlds. And if I may, it doesn't matter which side, plaintiffs or defendants, you're working on in civil work or even in criminal work, where the prosecution is brought by the state or the federal government in a criminal matter. The attorney's job on the other side of your opinion is to discredit you, as the attorneys put it, to impeach your credibility.
Right.
And their job is to destroy you and to do their best to, and I use this word carefully but accurately, some attorneys consider their job to be to annihilate your reputation.
Yeah.
And they can be not just a little bit rude in a deposition or at trial when you're on the witness stand, but they can come at you with all guns blazing and a torpedo to try to destroy you and your professional reputation, because their job is to protect their client. And in doing so, the more they can delist, deregister, demean your opinions, they're helping their client.
Right.
My experience in asking people who are brilliant psychiatrists, who are very clinically experienced, experts in their field, have you ever had an interest in doing forensics? And the answer is, why would I want to open up my experience to being attacked by attorneys on the other side? Or I'm afraid that if I'm on the witness stand and I forget something, or I make a mistake, or I word something poorly, I don't want to hurt anybody. But the root of that, I think, for the majority of people who could be excellent forensic experts, is fear.
Yeah, so that's so interesting, because I think you're probably right, but I don't relate to it. And so that's why I don't think of it, because when I'm on the witness stand and they want to, the attorneys wants to put words in my mouth, I just kind of get sharp-tongued and irritated, and I'm quick on my feet on the stand, and I say, don't put words in my mouth. That's not what I said. Or, the record says what the record says. We can't infer anything additional. This is what that means, and I can't speculate beyond that or whatever. And but I think some people feel intimidated, and I think, oh, you want to fight? Okay, let's spar then with this exchange. It doesn't have that effect on me. But psychiatrists are nice people who want to help. Doctors are nice people who want to help, and generally not people who want to have a confrontation. So I see what
You
you mean.
know, first of all, I think what you said was just eloquent and spot on target. We go into psychiatry because we are hopefully thoughtful, sensitive, certainly advocates for helping people who oftentimes struggle with mental health issues. And so none of that actually bears in the forensic arena unless you remind the jury or remind attorneys, or in bench trials, remind the judge that you do have great sympathy for people who are injured. You do have great sympathy for people who are mentally ill and commit crimes. And yet your opinions will be objective, and these are the opinions that you offer to the court.
Yeah, based on your expertise, based on your training and experience, and so forth. Okay.
Exactly.
Well, so I've probably taken up enough of your time, but I assume that when people are working with you in forensics, they find you through lawyers. Like you don't have a website that you publish that attorneys come and find you. They know you, right? They're out there networking. They've seen you in a case.
I have never advertised my forensic services. In fact, I've never had a website. I've never advertised my clinical services. I'm truly fortunate. I consider myself to be very blessed that, if we're sort of winding this down a little bit, I'll say to your audience, regardless of what their interest is in their profession, be it in medicine or not medicine, the most valuable thing you ever have in your community is your reputation as a professional, as an employee, as an employer. And so I have been very lucky that, again, going back to the fact that there's so few people in any state who will do forensic work, the attorneys keep their own, I think, confidential lists of experts in particular fields. I received a phone call 2 weeks ago from a very nice attorney in Chicago involving a lawsuit against the Cook County Health District, the hospital in Chicago. And I understood that she wanted to retain me in a psychiatry case. And I said, by the way, how did you get my name? You're in Chicago. I've never worked in Chicago. I've never worked in Illinois. And she said, well, I went to law school with an attorney in Houston, Tom Sartwell, and Mr. Sartwell and I communicate occasionally. And I emailed him and I said, do you happen to know a good psychiatry expert? And he said, I know one in Texas.
Mm-hmm. That's it. All word of mouth, reputation. Um,
All word of mouth.
mhm. That, well, I thank you. I assume people are not going to come and find you on the internet because you don't have a website, but that's not the nature of the work that you do. And I thank you so much for coming and talking to me and just, you've always been very, very generous with your time and support during the 20 years I've known you. And so just thank you for that too.
It has been my privilege and my joy to know you for 20 years, Melissa, and thank you for the opportunity to talk with you and your audience on your podcast today. I really enjoyed it.
Awesome.